Good afternoon. I want to just begin by just thanking the entire city, really friends from all across the community for your kind words, your messages, your notes. It's really been an incredible source of strength for me and for my brother and for my whole family. I think as most of you probably already know, my mother, Gabby O'Donnell, with a lot of sadness from us and our entire family, she passed away this last weekend. In fact, she passed away on Sunday. She died because of complications due to COVID-19, and she was only 61 years old. Now, my mother and I were actually very close. Anyone that knows how much of an impact she had on my life. We were obviously family, but also we were best friends. And my brother Jacob and I are both completely heartbroken. Now, our mom was absolutely the kindest and most compassionate person we've ever met. She's an immigrant. She came to the United States with me, at the time my father, my grandmother, and I was just a little kid seeing my mom work so hard to build a better life for us. She came to the United States for the American dream. And like many immigrant women, she started cleaning houses. She did odd-end jobs in thrift shops. We didn't have really any money or resources. But with a lot of work, she soon began picking up jobs in clinics, and then pretty soon landed her first full-time job in a clinic here in the LA area. And soon after that, landed a career in the current clinic she's been working at for over 25 years. She became, of course, a healthcare worker. And as a healthcare worker, over the course of her career, cared for thousands and thousands of patients, nurses, and doctors who she assisted every single day. She fortunately lived a very happy and joyous life. She was a happy person. And the one thing I've been thinking about a lot is she always said that one of her most joyous moments and the thing she's most proud of is that she became a U.S. citizen. It was one of the most proudest days of her life, and certainly for all of us to see her. And the one thing she always reflected on is how much she loved this country. This country has challenges. We have a lot of work to do to be a more equal place for everyone, but she had a lot of hope in our country. And I think about during these times, my mother's optimism in us building a better future and a better community. She always said to me and to my brother that we'll never be able to give back to our country what our country has given to us. And that's why both my brother and I have always been close to public service and went into education. I want to add that my brother and I want to just thank the nurses and doctors at Long Beach Memorial. I've always been a huge supporter of their work, but I am just beyond grateful and thankful for what they've done and the care that they did and that they performed for my mom in her last days. For those that might be watching, thank you so much. We are forever indebted to all of you and your hard work. And this is true for all nurses and all medical personnel that are working in all of our hospitals here locally and across the country, that are working so hard to get this virus under control and to not just care for families, but to stand in as family, as many of them are living their last days. They are heroes, and we are forever grateful for their service. Now, as you can imagine, and for many of you that have lost a parent, this is a very terrible thing to go through. It's very difficult. I also know at the same time, and everyone as part of our city team knows that we have a city to run. There was a lot of work to do to ensure that people across our city are safe, are cared for, and that we're moving towards a city that is more just and a place that has opportunities for everybody. I've also mentioned that my stepfather is also still on a ventilator. Unfortunately, he is still, while stable, is still fighting for his life. And that's something that we are putting a lot of energy and prayer into to ensure that he comes out with full recovery after he leaves the hospital. And I just want to know, and I want you all to know, that we all need to work together to ensure that this doesn't happen to other families. We've had over 175 individuals die in our city. I believe it's 176 people have died. In fact, just 6 over the last 24 hours. Every single one of those individuals has a family, has parents, has siblings, has sons or daughters, and they all deserve our respect and our love. They're not just a data point. They are human beings. And even as I stand here with you today, there are 101 individuals in our hospitals, in our Long Beach local hospitals, struggling and fighting for their lives against this virus. I know that together we can work to make our city more safe. And I'm reminded by the words of the doctors and nurses that I've been talking to over the last few weeks. They need our help. They want us to be safe and to take care of one another so that they can take care of our families. And even so, we know there's also good news that's been developing as it relates to COVID-19 in Long Beach. We had reached a high of 15.2% in our positivity rate just a couple of weeks ago. We went down to around 14%. Just a few days ago, we were closer to 12, and today we're at 10.9%. That means that we are making some progress. It doesn't mean that we should let up or that there's not a lot of work to do, but our positivity rate is going in the right direction. And the state believes we are on our road to 8%, which is what the state requires as a statewide baseline that really allows us to control the virus and really limit that community transmission. I'm also grateful that thanks to our amazing team at the city, we've improved our testing process. We had a real hard crunch a few weeks ago. We've expanded testing. We have private providers coming in, and there's great work happening around it with appointments available even today. And I'm proud of also our economic development team who is working with businesses to ensure that those that have been affected by COVID get the support they need. And there's a lot more work ahead. Joining us at this briefing, we're also going to hear from Dr. Davis, of course, who is our city's chief health officer, who's been doing really incredible work, and our director of economic development, John Keisler. He'll also be talking about some of the programs we have for our businesses. Again, I want to thank you all for your incredible support. In the days and weeks ahead, of course, we will continue to lead the city, and I will also continue to care for my family and to ensure that she transitions with the dignity and respect that she deserves. So with that today, Dr. Davis and Mr. Keisler will be answering any questions, and I want to thank you and introduce Dr. Davis.
Thank you, Mayor Garcia. I just want to say on behalf of the city and the health department that we're sorry for your loss. And you and your family are in our thoughts and prayers. Good afternoon. I'm Anissa Davis, the City Health Officer for the City of Long Beach. And today our briefing is for July 30th, 2020. Thank you for being here with us this afternoon. So first, to update us on our numbers, as of today, 8,099 residents have tested positive for COVID. Additionally, approximately 6,415 people have recovered. Sadly, we've lost 176 Long Beach residents to COVID-19. And our thoughts and prayers go out to all the families and loved ones of these residents. 120 of these fatalities have been associated with long-term care facilities. We continue to test at our various sites in the city, and as of yesterday, our positivity rate is 10.9%, which is a decrease, as the mayor mentioned before. To go over some new trends, with all the numbers I've shared, I want to discuss a couple of trends that we're beginning to see. We're noticing that the average age of cases and deaths is decreasing. So people are younger when they're getting diagnosed and are younger when they're dying. The median age of community cases, which is those that are outside of the long-term care facilities, basically we split up those people who are in long-term care facilities, such as skilled nursing facilities, and then those who are outside of those facilities in the community. So the median age of community cases used to be in the 40s in the beginning of May. And this has recently decreased to the low 30s, so young 30s is the median age of when people are diagnosed now. We're also noticing that those who pass away from COVID have become younger as well. It used to be that very few deaths in Long Beach were occurring outside of long-term care facilities. 2 months ago, only 1 in 5 deaths occurred among community residents. So basically 80% of those who had died 2 months ago were those from long-term care facilities, and 20% were those in the community. Now in July, more than half of all deaths in Long Beach have occurred among community residents and outside or not within the long-term care facility population. This change has also caused the age of our deaths to decline. While just 5 weeks ago, the median age of deaths in Long Beach was 86 years of age, this week the median age is 64, which is more than 20 years younger. Additionally, the proportion of hospitalizations among community members, as opposed to those from long-term care facilities, has risen to nearly 60%. A couple of months ago, it was as low as 25% of hospitalizations were community members, and 75% were among those from long-term care facilities. So now that's really flipped. And while most of our most severe cases of COVID-19 have occurred among people with underlying conditions, it's important to note that those conditions are very common in our population, including things like obesity and diabetes. With more cases, hospitalizations, and deaths in the community, and with younger populations being impacted, the take-home message is that in order to reduce transmission, we need to be vigilant about wearing our masks and about not gathering. So it's the things that younger people are doing and people out in our community that we really need to be focused on in order to reduce transmission. And those things are, again, wearing masks, staying physically distant from those not in your household, and not gathering with those that are not in your household. And we're seeing more and more evidence about the benefits of wearing masks, including a recent study that found that mandating the use of face coverings in public is associated with a decline in the daily COVID growth rate. And these mandates likely averted hundreds of thousands of cases. So this recent study is showing that wearing masks works. It's saving hospitalizations and saving lives. I know that we've been at this a while now and that the restrictions have changed our way of living in a lot of ways that we don't like, but these steps we take now are vital to the impact this disease will have on our future. So now I'd like to turn to our updated isolation and quarantine order. On July 28th, we issued revisions to these orders to align with the new updated CDC guidance for community-related exposure to COVID-19. So the new dates to our quarantine order, and again, quarantine is when you've been exposed to the virus, so that means somebody around you, you're a close contact to somebody with the virus. So the new updates for those individuals is if an individual is tested during the 14-day quarantine period, so that period when you should be staying in your home, and the result is negative, this does not exclude the individual from quarantine. So you have a 14-day quarantine that you need to do, and say you get a test at day 5 or day 10 of that 14-day period, and it's negative, that's reassuring, and you still have to finish your 14 days at home. In addition, if a person in quarantine starts to show symptoms and the different types of symptoms that are associated with COVID-19 now has grown. So I'm going to read you this list because these are all the different types of symptoms that could be COVID-19. So if you're in quarantine and you start to show symptoms such as fever, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea, you're required to isolate yourself and then follow the isolation order, even if those symptoms are mild. So we've also updated our isolation order. And the isolation order is for those who have either tested positive for COVID-19 or a healthcare provider has told them, we think you have COVID-19. Individuals who are required to isolate must stay in their residence until at least 10 days have passed since the symptoms started and at least 24 hours have passed since resolution of fever without the use of a fever-reducing medication and your other symptoms have improved. They don't have to all be gone, but they need to be better. Previously, you needed to have 3 days without a fever, but now it's 1 day, 24 hours without a fever. And as a reminder, employers should not require an employee to receive a negative COVID-19 test to return to work. If you are on isolation, you should use the criteria based either on your symptoms that I went through, or if you never had any symptoms, you base it on the day of your test, the day that you took the test that ended up becoming positive. You stay in isolation for 10 days from that date. And if you're in quarantine, you don't need to, employers should also not require a negative test to return to work in that instance as well. Just use the 14 days is sufficient. Next, I'd like to share some more information regarding contact tracing. Last week, I spoke about our health department's contact tracing efforts, including how our current system allows us to conduct contact tracing via telephone and our new efficient online survey. Since then, we've received a few reports of potential contact tracing scams that are taking place across the region. There's no question that contact tracing plays a vital role in helping to stop the spread of COVID-19. And if we call you from the health department, please answer our call because that will make a difference in stopping the spread. But scammers pretending to be contact tracers and taking advantage of how the process works are calling and sending text messages. So it's important to be vigilant and prepared to know the difference between scammers and legitimate contact tracers. Legitimate tracers will only confirm your demographics, which means your name, your age, your date of birth, your address, and ask where you may have visited recently and who you may have come in contact with. They will never ask you for money, your immigration status, your social security number, or your personal financial information. Real contact tracers may ask you for your name and address, your health information, and the names and places of people you have visited. So if anybody is asking you for anything having to do with money, your immigration status, social security number, that is not a legitimate contact tracer, and you do not need to answer those questions. If you receive a call and you're unsure about whether it's a real contact tracer or not, please call our COVID-19 info line at 562-570-4630 4636 to confirm that the person who contacted you is authorized by our health department. If you test positive for COVID-19, the health department may call you directly to ask questions, or you may receive an electronic survey via text or email. The information you provide is confidential and is very important to use to prevent further spread of disease in our city. You can also find more information on our contact tracing process on our website at www.longbeach.gov/COVID-19. So now I'm going to turn it over to John Keisler, the Director of the Long Beach Economic Development Department. Thank you.
Thank you, Dr. Davis. The economic emergency that's been caused by COVID-19 has entered a new phase nationally and locally in this economic crisis. As many of you know, the very important federal stimulus programs that for the past 13 weeks have provided as much as $600 additional income to over 60,000 Long Beach residents has ended. In fact, it ended last week. And what that means is that approximately $36 million per week that comes into Long Beach households, which pays for groceries and rent, it pays for food and other important essential services, will no longer be coming into the city of Long Beach, unless, of course, our Congress reaches another deal. That's approximately $460 million, almost $500 million that over these past 13 weeks has helped keep our economy going. And so as a result of that, as a result of these benefits expiring, we are likely going to see the incomes of over 60,000 Long Beach residents drop, in some cases by 60%, in some cases by 90% per week. And that's going to have a real immediate impact on our local economy. Additionally, many small businesses that received an estimated $360 million worth of paycheck protection loans and other federal-backed loans have also seen those loan amounts run out, and now are facing questions about whether they will keep their doors open and whether or not they will be able to survive. And so to offset this incredible economic emergency that has occurred and that is now evolving, the City Council has taken a number of bold actions. On July 14th, the Mayor and the City Council approved almost $40 million worth of COVID-19 relief funds as part of the CARES Act, a federal grant that provided over $19 million to offset the city emergency response, community support, over $14 million to invest in community needs for housing and homelessness, Black education, health, older adult resources, mental health and domestic violence prevention, youth workforce development, and many other programs. And what I wanted to share with you is that the council has also approved over $6 million worth of new business recovery and resiliency funds to support the transition for small businesses during this time. Many of these programs are set to roll out in August. So in just the next couple weeks, over $6 million worth of new economic support grants and some loans that I want to talk about today. Over $3.6 million for small business transition grants will soon be available to purchase equipment, pay rent, and create a healthy work environment for both customers and for workers. There's over $500,000 or $500,000 for business technology grants to provide contactless payment systems, online ordering systems, reservation systems, and other things to create a safe environment for customers and for workers. There's $750,000 that has been set aside to help small businesses and nonprofit organizations to purchase personal protective equipment, or PPE. And another $1 million has been set aside by the City Council and the Mayor for business improvement districts to help over 5,000 small businesses in key commercial corridors keep their lights on and stay afloat. Additionally, $250,000 has been set aside to provide educational materials and outreach about programs for small businesses seeking assistance, complying with COVID-19 requirements, about grant programs, and many more resources available to them. For information about these programs, the city established a website at www.longbeach.gov/4biz. That's the number 4, B-I-Z. Or interested businesses and workers can call 562-570-4biz. That's the number 4, B-I-Z, to learn more about these and other programs. Additionally, we will soon begin distribution of free business protection kits, which include masks, hand sanitizers, and other PPE for small businesses and nonprofits. This program is in partnership with the State of California and the Small Business Development Center, and will provide 5,000 local small businesses with hand sanitizer, masks, and face shields for their employees. Look for more information about this program in the coming days, and there will be a press release that will share information about how you can sign up and receive some of this important protective equipment. Additionally, the Mayor and City Council are scheduled to consider additional grant and loan programs for small businesses, which include $2.4 million worth of new small business loan funds from the Economic Development Administration. This will provide emergency loans to local small businesses that need assistance, or to businesses who are unable to receive the federal loan programs or loans from private commercial banks. Additionally, the Mayor and City Council have set aside $1 million in brand new grant funding for businesses that experienced damages by the events of May 31st. And so those funds will be considered at next week's council meeting. All business owners, workers, or residents can find more information about these loan programs either through our website at longbeach.gov/4biz or by calling our hotline at 570-4biz. Finally, earlier this week, the City Council and the Mayor extended a moratorium on evictions for both businesses and tenants, as well as for residents. This was extended through September 30th to deal with the economic impacts of COVID-19 over these next couple months, and allows residents and businesses to remain in place until health orders can be lifted and they can return to work safely or reopen their businesses. Also, rent will have to be repaid, but a full year will be allowed for businesses to stretch out those repayments. And this includes a prohibition on any late fees or penalties on Section 8 terminations and any other programs from our housing authority. The city has also launched a COVID-19 business resources website, which summarizes all of the available programs that I just described. So you don't have to remember them all. You can go online at www.longbeach.gov/4biz, or you can call our hotline Monday through Friday from 8 a.m. to 5 p.m. at 570-4biz. The city is also encouraging our businesses to access free technical assistance and consulting from our partners at the Small Business Development Center. These are experienced business owners who have now dedicated their time to helping small businesses navigate this difficult emergency. They will help you to understand different loan products and offer assistance in the application for loans. They'll help you develop and execute business plans to mitigate these interruptions. They will also help you reassess existing business practices and update business models for this new environment. They'll help with business and financial planning, making staffing decisions, and renegotiating leases with your landlords. All of this free of charge through the Small Business Development Center. The city staff is here to help you to interpret city health orders that are there to protect you and your customers as well as your workers. We're here to develop our business resource guide for you. Online, we have one-pagers that lay out many of the different strategies that you can use. And language access is a major priority of ours, both online and in the physical materials that we're providing will be translated into multiple language. And if you call our hotline, we'll find someone who speaks your language. Collaborating with community partners, our business associations, our community-based organizations, and our businesses themselves has been a priority for us to spread the word and increase the awareness about resources available. Conversations are occurring daily with different partners as we develop new grant programs, new loan programs, and new solutions. The main message that I want to share with you today is that you're not alone. We have a very difficult time ahead with regard to the local economy as well as the national economy. But your economic development department, your mayor, your city council, and all your city staff are here to help you navigate these difficult times. You're not alone. So give us a call, visit us online, and reach out. I'm now available to take any questions, and I'll turn it back over to Dr. Davis.
Thank you, John. We'll now take a few questions from the media. As a reminder, both Dr. Davis and John Keisler are available for questions. Our first question comes from Jory at ABC. Go ahead, Jory.
Hi, just to be clear that the mayor is not available for questions?
That is correct.
Okay. For Dr. Davis, we could tell that you were very emotional today, and the answer to this might be obvious, but if you can get into why today the emotions are so raw, whether that had to do with the mayor coming back to work so soon or just the totality of the numbers.
I think just, it just brings it home. So I hear a lot of the stories of the 176 people who have passed away. I also hear a lot of the stories of people who are unable to visit their loved ones in skilled nursing facilities because of the changes in visitation that we've had to do around this pandemic. It's really affected our staff. We've had people, that were in their 20s working until days before they passed away. So it's just it just brings it home.
Thank you. Our next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, Dr. Davis. So I am just wondering if you can, number one, update us on the local hospital capacity, and number two, you mentioned that there have been changes in the proportion of cases, deaths, hospitalizations in long-term care facilities versus in the community, and I'm just wondering if there have been any changes in the numbers of long-term care facilities that might be impacting those proportions.
Yes, thank you. So the first question was about hospital utilization and capacity. We're doing okay as far as capacity goes. We have the capacity that we need to take care of the patients who are coming in, both with COVID and not with COVID. Because the numbers of people with COVID is increasing and the number of people needing to be hospitalized is increasing, of course that is putting more strain on hospitals. But right now, they are able to, the hospitals in our region are able to absorb that demand. And so we're in really close conversation to ensure that that continues and to provide support in any way necessary, both at the state and regional level, as well as locally. Your question, the next question was about.
Can you repeat your question, Haley?
Sure, yeah. It was about the difference, and I guess.
Yes, got it. Thank you. So it's a little bit of both. So as far as like what's accounting for the fact that there's now more community members who are hospitalized, or there are a higher proportion of those who are hospitalized and those who are passing away versus those from long-term care facilities. So it is true that there has been a decrease in people in long-term care facilities who have needed to be hospitalized and who have passed away. Which is great news. We've been working really hard, and the skilled nursing facilities, their management and staff have been working really diligently to address, to make sure that we're doing everything that we can to decrease those numbers. And loved ones are also playing a part by adhering to all of the precautions that we ask of them. So there has been somewhat of a decrease there. But the larger driver is the significant increase in community members who are being hospitalized and who are dying. So that's more of the driver and more of why the proportion is increasing in that population.
Thank you, Dr. Davis. Next question comes from Brian at the Long Beach Post. Go ahead, Brian.
My question is for Mr. Keisler. A group of over 50 local independent full-service restaurants have created the Long Beach Restaurant Association, and there's also a separate effort to create a local chapter of the California Restaurant Association because they feel they don't have a powerful enough voice to address their political and economic needs during these times. Both have asserted that no one is at fault, that both the city and their industry remains in crisis mode, but they feel that the situation could have been better handled and prevented product loss, employee layoffs, and potential business closures. Do you feel the city is addressing the economic needs of full-service restaurants properly? And if so, what are you guys doing to directly direct their issues?
Yeah, thank you, Brian. So we're certainly doing the absolute best that we can given the circumstances, which, as you mentioned, there's tremendous uncertainty. Thus far, the City Council and the Mayor have approved a number of strategies: eviction moratoriums, emergency small business loans, fee deferments. And our Workforce Development Agency has been working with many of our local employers and over 60,000 displaced workers to secure unemployment insurance benefits, grants, loans, and other technical assistance. Even our Public Works Department has started to open streets, expand dining and a capacity for dining into the public right-of-way, and our Development Services Department has modified licensing and permitting requirements so that they can expand their operation and hopefully serve more customers. But I will say this, every single person, the mayor, the city council, city staff, we wish we could do more, and we're looking for ways to do more. So we're very happy, absolutely very happy to work with this group, with this sector of the economy, to try to find new and creative ways to address their needs, to help their businesses survive through this difficult, uncertain time as we battle the public health crisis. And our goal is to work together to then develop the solutions that we'll need for them to reopen as the health orders are lifted and resume normal business.
Thank you, John. Next question comes from Elena at the Long Beach Business Journal. Go ahead, Elena. Elena, are you there?
Yeah, can you hear me?
Yes, we can. Go ahead.
Okay, my question is also for Mr. Keisler, and I'd love to learn a little bit more about the business recovery and resiliency portion of the CARES funds. Could you talk a little bit more about what requirements businesses will have to meet in order to qualify for those funds and what the application timeline will look like?
Yeah, excellent question. So the good news is that Council provided very clear direction about their priorities with regard to the distribution of these funds. There, of course, are some federal requirements attached to federal grant funds, which we will be sharing in detail over the coming days. They will also be able to apply and read about those requirements through a one-stop shop online portal. That was something that the City Council explicitly asked for. It was an easy process where all businesses could apply once, share their information, and then staff could evaluate whether they were eligible for 1, 2, or maybe even more grant programs through a single application process. I'm happy to say that that online portal is already built. We are loading the criteria. And ultimately, we will be building in the City Council priorities that were discussed on July 14th. Some of those priorities for these economic support funds include sectors that were hit hardest by COVID-19. So as you know, some sectors were determined to be non-essential and were hit harder than others. Some are high contact types of business activities, which requires additional cost because of the high contact with customers, in-person contact. Census tracts or areas of the city that are considered hardest hit by COVID-19 infection rates. And then populations or demographics of business owners that have experienced higher financial hardship. So lower median income business owners in lower median income areas. So all of those criteria will have a bearing on the assessment of the grant applications, and they will help for the city staff to evaluate need. But I think it should be clear that the council established a need-based process and a need-based criteria with a focus on those businesses that are at greatest risk for failure, those businesses that have been hit hardest by COVID-19. And so we will be doing our best job to fulfill the City Council's objectives and to keep as many storefronts open as possible. So volume and breadth is a priority. And remember, there are 25,000 licensed businesses in the city, which means that $5 million of business support funds will go very quickly for 25,000 businesses. So we need to be very thoughtful and deliberate to have the kind of impact that the City Council wants to have in the community.
Thank you, John. Now we have one question from social media for Dr. Davis. Dr. Davis, why should people continue to quarantine even if they tested negative after being exposed?
Thank you for that question. So basically the answer is that it can take time for your body to have enough virus to trigger a positive test. So it could be that you were a close contact, you were exposed on July 1st. And you did get infected at that time. You were close, the virus got into your nose or your mouth, and it's basically going to kind of set up shop in your body and start reproducing. And so say you need this much virus in order to trigger a positive test. So it could be that, so as you're going through your 14-day quarantine, somewhere along the 14 days, you're gonna get there, but we don't know exactly what day that's going to be. So let's say you're at day 5 of your 14-day quarantine and you decide, oh, I'm gonna get a test and I wanna know kind of where I stand right now. If that test is negative, it could be because your, the amount of virus in your body is at this level and it's not at this level, which is what you need in order to trigger a positive test. So it could be at day 5 you're at this level, and you just need like 4 or 5 more days to get to this level where you will then have a positive test. So the reason to do a test if you're in quarantine is because if it's positive, it helps. Then we know that, yes, you're infected, and then we can start the clock for you for your isolation. So now you've become a case, you need to do the isolation clearance, so forget about quarantine now, because now you're a case, so you're going to do isolation for, again, 10 days from the start of your symptoms or from the date of that positive test, making sure that you have a day with no fever and that your symptoms get better. So that's really the reason why you have to follow that 14 days, because it can take 14 days for you to have a positive test, assuming that you're infected. If you make it to 14 days and you don't have symptoms, then we assume you haven't been infected and you can return to work or return to your regular activities. But if you have a positive test during that time, now you're going to do the isolation. So you have 10 more days, unfortunately, tacked on now. That's also the same reason why it's important, or we don't recommend, that employers require a test to return to work. It's that same issue. So it could be that you're exposed, you didn't know, but you're exposed on July 1st. You get the test on July 5th so that you can go back to work on July 6th, but you're just not there yet. You just needed a few more days, and now you're going to have a positive test. So, and so it just tells you that that day, it doesn't look like you're infected. The other thing that can happen is you took the test, let's say at 5 o'clock on whatever day it was, let's say July 5th, 5 o'clock. You can walk out of that test site, 6 o'clock, be in close contact with somebody with the virus, and get infected then. So all that test told you was that the moment you took that test, it doesn't look like you're infected. It really doesn't help you know that you're okay to work without infecting other people, that you're not infected 2 or 3 days later. So really, the test helps you when it's positive. When it's negative, it's a little bit murkier.
Thank you, Dr. Davis. That concludes our questions, and now we will have Spanish translation.
Muy buenas tardes. A principios de esta semana y con profunda tristeza compartimos que la madre del alcalde García, Gaby O'Donnell, de 61 años, falleció debido a complicaciones de COVID-19. El alcalde informó de su muy cercana relación con su madre y él y su hermano están desconsolados. Compartió que su madre fue la persona más amable y compasiva que ha conocido, emigrando a los Estados Unidos desde Perú en busca del sueño americano y lo encontró. Empezó limpiando casas y se convirtió en trabajadora de salud, cuidando a miles de pacientes a lo largo de su carrera y ayudando a enfermeras y médicos a quien amaba mucho. Trabajó en esa última clínica por más de 25 años. El alcalde y su hermano quieren agradecer al increíble equipo de Long Beach Memorial por cuidar a su madre durante sus últimos días. Son héroes y están eternamente agradecidos. Su padrastro, Greg O'Donnell, sigue en el hospital en un ventilador y oramos y esperemos una recuperación completa. El alcalde dijo que la demostración de amor y apoyo de esta comunidad ha sido increíble y están profundamente agradecidos por todos los mensajes que han recibido. Voy ahorita a leer un poco de sus palabras directas. En el nombre de mi hermano y yo, quiero agradecerle a todos por su amabilidad. Me están brindando consuelo a mí y a mi familia durante este momento difícil y lo aprecio mucho. Por lo tanto, hoy estoy aquí ante usted, no solo como su alcalde, sino como un hijo en luto, y les pido que se cuiden y tengan en cuenta cómo sus acciones pueden ayudar o dañar a otros. Hay 176 familias en Long Beach que están pasando por lo mismo que mi familia, porque han sufrido la pérdida de un ser querido que ha morido por el virus. Y mientras estoy aquí, hay 101 familiares que tienen un ser querido en el hospital luchando por sus vidas. Cada uno de nosotros y todos nosotros podemos marcar la diferencia. Actuar inteligentemente durante ese tiempo me trae y debería de traer a todos esperanza. El alcalde también mencionó que hace unas semanas nuestra tasa de positividad estaba en un máximo de 15.2%, pero desde entonces se ha reducido y ahorita está en un 10.9%. Desafortunadamente, eso no es lo suficiente. Debemos llegar al menos 8% o menos y permanecer ahí para minimizar la propagación de COVID-19 y evitar que más personas pierdan la vida. Terminó el alcalde diciendo: sé que no soy el único hijo que ha perdido a una madre a causa de COVID-19 y desafortunadamente habrá otros como yo en el futuro. Y así, por favor, sigan siendo amables entre sí, se apoyen mutuamente de manera segura y cuidarse el uno al otro. Con eso me tomaré este tiempo para regresar a casa, para pasar tiempo con mi familia y hacer las preparaciones que se merece mi madre. Palabras de nuestro alcalde, Roberto García. Seguimos con nuestro comunicado de prensa de hoy, jueves 30 de julio del 2020. Gracias por acompañarnos. Vamos a empezar ahorita con información general. A partir de hoy, 8,099 residentes han dado positivo por COVID. Además, 6,415 personas se han recuperado. Desafortunadamente, durante este tiempo hemos perdido un total de 176 residentes de Long Beach por COVID-19 y de esas muertes, 120 se han asociado con centros de atención a largo plazo. Continuamos haciendo pruebas en nuestros diversos sitios en la ciudad y como mencioné anteriormente, la tasa de positividad está ahorita al 10.9%. Vamos ahorita a hablar sobre nuevas tendencias que estamos viendo. La edad promedio de los casos y muertes ha disminuido. La mediana de edad de los casos de la comunidad, aquellos fuera de los centros de atención a largo plazo, solía ser de unos 40 años a principio de mayo. Esto ha bajado recientemente a personas en sus principios de sus 30s. En otras palabras, la gente está resultando positivo más joven y falleciendo más joven. Aquellos que fallecen de COVID también se han vuelto más jóvenes, como mencioné, y solía ser que pocas muertes en Long Beach ocurrían fuera de esos centros de atención a largo plazo. Hace 2 meses, solo 1 de cada 5 de nuestras muertes ocurrían fuera de esas instalaciones. Ahora, en julio, más de la mitad de las muertes son de la comunidad y fuera de esos centros de atención a largo plazo. Este cambio también ha provocado que la edad de muertes disminuya, o sea, de la cantidad la edad de esas personas, mientras que hace solo 5 semanas la edad promedio de las muertes en Long Beach era de 86 años. Esta semana la edad promedio es de 64 años, más de 20 años menor. Además, el porcentaje de hospitalizaciones de miembros de la comunidad ha aumentado a casi el 60% ahorita. Cuando empezó esto era del 25%, ahora los casos de la comunidad están en el 60%. Y aunque la mayoría de nuestros casos más graves de COVID-19 se han producido entre personas con problemas de salud, es importante tener en cuenta que estos problemas de salud subyacentes son muy comunes e incluso cosas como la obesidad y la diabetes tipo 2. Con más casos, hospitalizaciones y muertes en la comunidad y con más jóvenes de la población afectados, el mensaje final es que para reducir la transmisión debemos estar atentos a usar nuestras mascarillas y no reunirnos. Reunirse incluso en grupos pequeños o con miembros de la familia que no son parte de nuestra familia inmediata es un riesgo importante para contraer el virus. Estamos viendo cada vez más evidencia sobre los beneficios de usar las máscaras o mascarillas, incluyendo un estudio reciente que encontró que el uso obligatorio de cubiertas faciales en público está asociado con una disminución en la tasa de crecimiento diaria de COVID-19. Y estos mandatos probablemente evitaron cientos de miles de casos. Ahora vamos a hablar sobre aislamiento y las órdenes de cuarentena. Hay unos cambios que queremos asegurar que la comunidad esté informada. Hay algunos elementos en los que me gustaría hablar, comenzando con las órdenes de salud de aislamiento y cuarentena actualizada ahorita en la ciudad de Long Beach. Esto pasó el 28 de julio. Las órdenes para alinearse son con las guías del CDC para la exposición relacionada con la comunidad al COVID-19. Las nuevas actualizaciones de nuestras notas de orden de cuarentena. Entonces, es un poquito diferente de lo que habíamos antes visto. Si un individuo es evaluado durante el periodo de cuarentena de 14 días y el resultado es negativo, o sea, su prueba sale negativa, esto no excluye al individuo de la cuarentena. Debe permanecer en cuarentena durante los 14 días completos. La razón por esto, y la doctora habló sobre esto, es que si uno es expuesto al virus y se toma el examen al tercer día de haber sido expuesto, se necesita suficiente virus en el cuerpo para salir positivo en ese examen. Si usted se toma el examen en el tercer día, pero necesita hasta el quinto o sexto día para que el virus esté suficiente activo en su cuerpo para salir positivo, cuando usted agarre los resultados y salga negativo en el examen, significa que quizás ese día el virus todavía no estaba suficientemente activo en su cuerpo para salir positivo, pero no se puede decir que si se vuelve a tomar el examen el día 5 o 6, quizá pueda salir positivo. Es por eso que ahora se requiere que siga los 14 días en cuarentena para asegurar que no vaya a exponer a nadie. También la lista de síntomas ha crecido y voy a hablar sobre ellos aquí. Si una persona en cuarentena comienza a mostrar síntomas como fiebre, tos, falta de aliento, fatiga, dolores musculares o corporales, dolor de cabeza, nueva pérdida de sabor o olfato, dolor de garganta, congestión o secreción nasal, náuseas o vómitos o diarrea, deben aislarse y luego seguir la orden de aislamiento. También hemos actualizado nuestra orden de aislamiento para incluir lo siguiente. Las personas que deben aislarse deben permanecer en una residencia hasta que, 1, han transcurrido al menos 10 días desde el inicio de los síntomas y han transcurrido al menos 24 horas desde su última fiebre, sin tomar medicamento. Anteriormente eso era 72 horas, ahora están pidiendo que sea 24 horas libre de fiebre. Como recordatorio, los empleadores no deben exigir que un empleador reciba una prueba COVID-19 negativa para regresar al trabajo. Los empleadores deberían utilizar los criterios basados en los síntomas y el tiempo requerido por estas órdenes. Otra vez, como mencionamos, si un trabajador es expuesto y al día siguiente luego va a tomarse el examen, quizás el virus no ha crecido suficiente en su cuerpo para salir positivo, porque luego reciben sus resultados, quizás sea negativo, pero podría ser positivo porque ese virus todavía no ha crecido suficiente en su cuerpo. Vamos a hablar sobre los seguimientos de contactos. La semana pasada hablamos sobre los esfuerzos de rastreo de contactos en nuestro Departamento de Salud, que incluía la forma en que nuestro sistema actual no permite realizar el rastreo de contactos por teléfono o nuestra nueva encuesta eficiente en línea. Desde entonces, hemos recibido algunos informes de posibles estafas de rastreo de contactos que están teniendo lugar en toda la región. El rastreo de contactos juega un papel vital para ayudar a detener la propagación del virus, pero los estafadores, pretendiendo ser rastreadores de contactos y aprovechándose cómo funciona este proceso, están llamando y enviando mensajes de texto. Debe estar atento y preparado para conocer la diferencia entre los estafadores y los rastreadores legítimos de la ciudad. Los rastreadores de contactos legítimos solo confirmarán sus datos demográficos y le preguntan dónde puede haber usted visitado recientemente y con quién pudo haber estado en contacto. Jamás le pedirán dinero, su estado migratorio, su número de seguro social o cualquier información financiera personal. Los rastreadores de contactos reales pueden solicitar su nombre y dirección, información de salud, los nombres de lugares y personas que ha visitado, y los estafadores siempre le pedirán algo más. Si recibe una llamada y no está seguro acerca de la legitimidad de la persona que llama, llame a nuestra línea de información de COVID-19 al 562-570-4636. Esto es para confirmar que la persona que lo está contactando es autorizado por nuestro Departamento de Salud. Si su resultado es positivo para COVID-19, el Departamento de Salud puede llamarlo directamente para hacer preguntas o puede recibir una encuesta electrónica por mensaje de texto o correo electrónico. La información que usted dará a esa persona es confidencial y se utilizará para prevenir una mayor propagación de enfermedades en nuestra ciudad. También puede encontrar más información sobre nuestro proceso de búsqueda de contactos en nuestro sitio de web en www.longbeach.gov/COVID-19. Ahora vamos a hablar un poco sobre el desarrollo económico. Esos son los esfuerzos de ayuda en Long Beach para trabajadores y pequeñas empresas por COVID-19. La emergencia económica causada por COVID-19 ha entrado en una nueva fase esta semana, ya que el programa de estímulo federal, que estuvo disponible por 13 semanas, que daba un adicional de $600 por semana, ha terminado el 25 de julio. Los residentes de Long Beach utilizaron esos ingresos adicionales para pagar el alquiler, los servicios públicos, combustibles y servicios esenciales. Estos dólares dieron ingresos esenciales para las pequeñas empresas locales que brindan servicios. Se estima que ese programa dará $36 millones adicionales por semana a aproximadamente 60,000 trabajadores de Long Beach que perdieron sus empleos debido a COVID-19. Eso es aproximadamente 460 millones de inversión local en las últimas 13 semanas, más que cualquier otra fuente individual de ingresos o inversión en la ciudad. Como resultado, por primera vez en más de 3 meses, decenas de miles de trabajadores de Long Beach verán que sus ingresos caigan del 60 al 90%, y muchos propietarios y pequeñas empresas sentirán los impactos inmediatos de esta pérdida de ingresos. Además, las pequeñas empresas que recibieron aproximadamente $360 millones en préstamos del Programa Federal de Protección de Pagos han visto que estos fondos comienzan a agotarse y se enfrentan a nuevas preguntas sobre si continuarán las operaciones de forma limitada hasta que puedan reabrir y reanudar las operaciones. Ahora vamos a hablar sobre el liderazgo y el ayuntamiento aquí de la ciudad. Para ayudar a compensar los impactos inmediatos de la emergencia económica que enfrentan muchos hogares de Long Beach, el alcalde y el ayuntamiento han tomado varias medidas audaces. El 14 de julio, el Consejo Municipal aprobó aproximadamente $40 millones para el alivio de COVID-19. Muchos de estos programas se estarán disponibles en agosto para ayudar a los trabajadores, propietarios y pequeñas empresas, incluidos más de 6 millones para subvenciones de apoyo económico. Para más información, por favor, visite www.longbbeach.gov/4BIZ o llame al 562-470-4BIZ para obtener más información sobre estos y otros programas. A partir de la próxima semana, en asociación con el Estado de California y el Centro Regional de Desarrollo de Pequeños Negocios de la ciudad comenzará a distribuir kits de protección de negocios gratuitos para pequeños negocios locales y organizaciones sin fines de lucro. Otra vez les recuerdo, para más información, visite www.longbbeach.gov/4BIZ o llamar al 562-570-4BIZ. Además, el alcalde y el consejo municipal están programados para considerar programas adicionales y préstamos para pequeñas empresas. Dueños de negocios pueden solicitar todos estos programas de subvenciones y préstamos a través de un portal de solicitud en línea de una sola parada, visitando la misma página de web que les acabo de mencionar. A principios de esta semana se extendió recientemente hasta el 30 de septiembre del 2020 una moratoria sobre todos los desalojos por falta de pago relacionados con COVID-19 en unidades comerciales y residenciales. En otras palabras, ahorita personas no pueden recibir ninguna orden de alojamiento por falta de pago. La ciudad también lanzó un sitio de web de recursos comerciales COVID-19 que resume los programas disponibles, dando más información de contactos importantes y una línea directa de negocios para responder preguntas y dirigir a los clientes a recursos importantes como asistencia técnica, asistencia financiera, programas de aversión y despido y más. Finalmente, la ciudad está alentando a las empresas a que se metan a pedir asistencia técnica gratuita desde el Centro de Desarrollo de Pequeñas Empresas que puede ayudar con cualquier problema que tenga. El personal de la ciudad está ayudando a las personas a interpretar a la orden de salud de la ciudad para determinar si su negocio es esencial o no. También mencionaron que en una aplicación pueden asistirle para determinar si puede ser elegible para 1, 2 o más programas con solo una aplicación. El acceso al idioma es una prioridad y los materiales físicos y en línea se ofrecerán en varios idiomas. El último mensaje que quiere la ciudad que todos ustedes sepan es que el mensaje principal que la ciudad y los socios están enviando a las empresas es que no están solos. Por favor, asegúrese que se contacte a la página de web que acabo de mencionar o también llamando al número 562-570-4BIZ. Eso es todo por hoy. Gracias por acompañarnos. That is all for today. Thank you for joining us.